Okay, so when your patients arrive for their pre-anaesthetic checks, the nurses obviously do a full health check. So it starts with weighing each patient. So as you can see in this little carriage, we've got 3 little bundles of fluff today. So each one's going to get a weight, and then their weights will get recorded so that we can record and work out their pre-med drugs. Once they've had their weight done, the nurses just quickly check their heart to make sure that everything sounds okay. There's no obvious signs of murmurs or any gurgling from their chest or anything like that. And then these 3 are in for castration today, so we always just check that they have both their testicles present pre-operatively so we know everything's okay. Yeah. And then they'll go back to bed, and the next one will be done. Once they've all been weighed and checked, they then go off to their kennel where we draw up their pre-meds. Okay, so now we've got all the drugs prepared, the kittens now need to have their pre-med. So the point of a pre-med is to lower the amount of anaesthetic that's needed, and also to make them a little bit sleepy, and also to provide them with some pain relief. So we just get them nice and secure on a nice towel, and then their injections go into the scruff, just like a vaccination would. And as you can see, he didn't really care, he's having a good sniff around. Now sometimes this one can be a little bit stingy, but again, just into the scruff of his neck. And this one is the actual pre-med, so this will just make him a little bit sleepy. And very brave boy, he didn't really mind. Okay, so following his pre-med, he's now nice and sleepy and ready to be anaesthetised for his procedure. So we have everything prepared ready, so the clippers to shave the fur, the anaesthetic agent and some spirit to clean the area. So we just wrap them up nicely in a bit of a kitten burrito in the towel. It makes them feel nice and secure and safe. And then Lizzie's just prepping the area ready to give the intravenous anaesthetic. So we clip the fur, Josie then raises the vein, which just helps increase the blood pressure to that area to make the site of the vein a bit easier. And then Lizzie uses a small needle to place the needle into the vein, draw back a little flash of blood, and then gently inject the anaesthetic into the leg vein. Very good patient, he didn't mind at all. And now, as quick as that, he's gone all sleepy. So now ready for the surgery, Josie will turn him around and place him onto the anaesthetic and the oxygen. So he's just a little baby, so he just has a little face mask to prepare him initially. And we'll save you from the gory part of the surgery and come back to the rest of his journey later. Okay, so all 3 boys have now had their procedure, and as you can see, they're all wide awake and raring to go. So now, after any anaesthetic, we like to offer them a little bit of food, especially with the younger animals, because they've been starved for a period of time. This is a skill in itself, as trying to get in with the 3 hungry kittens can be quite tricky, but Josie's managed. So they each have their little individual bowls of food to make sure that their blood sugars and everything are well after their anaesthetic. And you can see they don't even really realise they've had anything done, and they're all tucking into their lunch. Home.